Welcome to the UC Health and University of Cincinnati Cancer Center's Lymphedema Education video. Lymphedema is a condition that could affect anyone. If you have undergone surgery, radiation, chemotherapy, or other such treatments for cancer, you could develop the medical condition known as lymphedema. In this video, we will explain how lymphedema could develop in your body, how you can identify its symptoms, and why you should seek immediate attention from your medical provider for this condition. Dr. Jamie Lewis is a surgeon and medical doctor at UC Health. As a passionate advocate for lymphedema education, Dr. Lewis wants to speak to you directly about the importance of spotting lymphedema early and partnering with trained medical lymphedema experts.
Hello, I am Dr. Jamie Lewis. As a breast cancer surgeon, I know firsthand the importance of spotting the early signs of lymphedema. Through early intervention, you can reduce the symptoms and future complications of this disease. In a moment, some of our expert lymphedema therapists at UC Health will share with you how, through self-examination and regular monitoring, you can identify this condition and how you can work with your healthcare provider to minimize the development of more serious problems. As a patient of UC Health and the University of Cincinnati Cancer Center, we want to empower you with this information. On behalf of the University of Cincinnati Cancer Center, thank you for listening.
The lymphatic system is part of the body's fluid recycling system, and it's vital for our health. The circulatory system moves blood throughout the body. Arteries supply oxygen and nutritionally rich blood to our tissues, and veins return blood depleted of nutrients and oxygen and other waste molecules back to the body so the blood can be cleaned and then reinfused with oxygen and nutrients again. Sometimes, small amounts of fluid that are moving through our tissues are not picked up in our veins. And other times, large particles like protein waste are too large for the tiny veins to transport. The lymphatic system, like our blood circulatory system, is made up of a network of vessels and nodes. This system is specially designed to collect those fluids that are left behind. Together, these two systems work in tandem to ensure that all fluids and waste products are properly recycled by the body. This silent and continuous process of fluid regulating and recycling keeps us healthy. Occasionally, this important lymphatic process can become disturbed. And when it does, fluids can begin to build up in one area of the body and cause problems. Medical interventions like surgeries, radiation, and sometimes chemotherapy can directly impact the lymphatic system's ability to collect and recycle these body fluids. For example, if you have had breast, prostate, or other surgeries, or received radiation treatments, the lymphatic nodes and vessels in the area of your treatment could have been negatively impacted or even possibly removed, thus hindering the fluid transfer process. When fluids begin to build up and start causing physical issues, we call this disease lymphedema.
Many people have never heard about lymphedema, but if it starts and it's left untreated, it can become a serious health issue. This is why patient education is so important for people who are at risk for lymphedema. Early signs of lymphedema can be very subtle and sometimes mistaken for other things. That is why we teach patients how to recognize the signs of the onset of lymphedema and to monitor themselves regularly for its symptoms, because early detection of lymphedema is critical.
One of the biggest issues with lymphedema is that it can take months or even years to develop. These symptoms can develop so slowly that sometimes patients check themselves for symptoms less frequently as time passes.
Medical experts encourage patients to stay vigilant about checking themselves for signs of lymphedema, because early detection and medical intervention can dramatically reduce and sometimes even reverse lymphedema's damaging effects. To help you identify these early symptoms, let's review some early indicators that lymphedema could be developing in your body. If one or more of these following symptoms begin to arise, seek the advice of a trained lymphedema specialist as soon as possible. Typical symptoms that indicate lymphedema may be occurring include swelling. When the lymphatic system cannot move fluids effectively, swelling in one or more parts of the body may occur.
If you notice that one of your arms or legs is slowly getting larger than the other, this could be a sign of the onset of lymphedema. While overall body swelling could be caused by several factors, localized and isolated swelling that occurs in only one part of the body could be the result of fluid buildup. This is why early detection of these symptoms is so important.
Early signs of lymphedema swelling can also be spotted by paying close attention to how clothing and other items fit against your body.
If you had surgery on your left arm or right leg, it's normal to have some swelling immediately after your medical procedure. But if over time you detect swelling in or around that area, like you notice that your pants, your blouse, or even your rings, watches, or bracelets are now fitting tighter than they used to, this may not be normal swelling and you should mention it to your healthcare provider.
It's normal for us also to think that swelling may be the result of simple weight gain. This is why identifying early signs of lymphedema can be tricky.
When you notice any swelling, monitor it closely. If the swelling persists in a localized area that does not appear on the other side of the body, your body fluids could be building up. Other symptoms to watch for are feelings of heaviness in the limbs or achy or dull pain in the area associated with your medical treatment.
Sometimes, even before you notice that swelling has occurred, you may feel a heaviness or a full sensation in your body. This is especially noticeable in your arm or your leg if that area was impacted by treatments. Even your chest, breast, or groin area may develop a sensation of unusual heaviness. This could be a symptom of fluid starting to build up and your body sensing a change in that area.
If not properly addressed, lymphedema and the swelling it creates can eventually progress to the point to where it starts to impact your body's ability to move.
When fluid starts to build up, you may feel a little more difficulty in lifting your arms or bending your legs or elbows. When making a fist or other movements, it may feel more restricted than normal. You may notice that your hand, wrist, or ankle are not as flexible as they were previously. Look for localized swelling or anything that may indicate lymphedema. If these symptoms continue for more than a few weeks and do not change, or if they slowly get worse, seek an evaluation from your doctor.
The importance of early symptom identification and intervention cannot be overstated.
If left untreated, the swelling from lymphedema can impact many body processes. This lack of blood flow could cause other complications, including serious infection, further loss of normal function, and potentially permanent body tissue damage.
Each patient's lymphedema situation is unique, as the specific treatments we receive in the past, how our bodies react to them, and our personal health conditions are different. This is why seeking your doctor's advice and working with a highly trained certified lymphedema specialist is important. The most effective way to prevent the progression of this disease is to work with you to design specific treatments for your personal lymphedema condition.
There are two great pieces of news about today's lymphedema therapy. First is that properly designed treatment techniques can easily be done by the patient on their own time and in their own homes. After a patient receives a diagnosis of lymphedema, a certified therapist like me will design a treatment plan just for you. We can show you how to perform these techniques yourself. Then, in a series of periodic follow-up visits, your therapist will assess your progress and modify your treatment plan as you improve.
And there's some other good news. With a properly designed therapy plan and your commitment to following through on your home program, the progression of lymphedema may be stopped or even reversed in some situations.
While the treatments you receive from a certified therapist can be very helpful, the most important aspect of an effective lymphedema treatment program is our patients learning how to perform these fluid reduction techniques on themselves.
For example, therapists can teach you specific lymphedema self-massage techniques that you can perform on yourself at home. We will also show you how to use specialized compression garments and wrapping techniques that will help prevent the accumulation of fluid. Other effective techniques include instruction on skin care and individualized exercise programs that are safe and healthy for you.
In the years before lymphedema was fully understood, many myths evolved about what actually causes lymphedema and what kinds of activities may make it worse. Like many stories from the past, some of these myths are still repeated today. Advanced scientific research about the lymphatic system and how the disease of lymphedema progresses has provided us a deep understanding of this important aspect of our body and what does and does not influence lymphedema. To ensure our patients have accurate information, let's touch on some of the most common myths about this condition.
I assure patients that being mobile and performing your regular daily activities does not cause lymphedema. And if a patient is diagnosed with early stages of lymphedema, our certified lymphedema therapist at UC Health know many proven and tested strategies for helping to address its symptoms. Even activities like weight training and strenuous exercises are okay as long as patients discuss their activities with their physical therapist first to make sure that they are appropriate.
Another myth about lymphedema involves flying on planes. Some people believe that simply getting on a plane and taking a plane flight can cause lymphedema. Research has shown that the typical effects of plane flight on a human body do not cause the origins of lymphedema. If you have received cancer treatments and your lymphatic system has been compromised, the difference in a plane's cabin pressure can sometimes enhance the amount of fluid buildup during the flying time. However, patients that have received a properly designed lymphedema program learn simple and effective techniques for mitigating these problems while traveling through the use of specially selected compression and other wrap garments.
Procedures involving needles and having your blood pressure taken are very common, necessary medical activities. Because lymphedema affects the tissues in one area of the body, it's always best to have any blood draws, inoculations, or blood pressure testing done on the side of the body that is not affected with lymphedema. Performing these procedures directly in the area where lymphedema exists should only be done when absolutely necessary. As a patient, make sure you share this information with any healthcare provider who may not know about your condition. If you ever have any questions about lymphedema symptoms or your personal condition, make sure to speak to your therapist. All of us are here to help you.
Because undergoing treatment for cancer can put you at risk for developing lymphedema, we wanted to provide you with this important information. We hope this video motivates you to actively monitor yourself for early signs of this disease and helps to reinforce the importance of working with a certified lymphedema specialist. At the University of Cincinnati Cancer Center and UC Health, we say, in science lives hope. And it's science that has helped to develop our effective lymphedema treatments that can help you to prevent progression of the disease, to improve any pain, swelling, or heaviness from fluid buildup, to decrease the risk of infections in your body, to learn easy and proven techniques so you can self-manage this disease, and to return you to the level of functionality you enjoyed before lymphedema began. I'm Dr. Jamie Lewis. On behalf of UC Health and our team at the University of Cincinnati Cancer Center, thank you for watching.